Hello, everyone, and welcome to another edition of Clock Talk with Dr. Greg Brannon. Greg, how are you today?
Fantastic.
You ready to go 15 minutes with chock full of information?
I love the pressure. It feels like no, and the next thing you know, we go overboard. So yeah, the answer is yes, I'd love to.
So as always, Optimal Bio uses exclusively the bioidentical pellet.
Yep.
It's a BHRT treatment, bioidentical hormone replacement therapy. We do not use shots, creams, or any other type of application. So today I want to talk about the benefits of the pellet compared to the other applications in testosterone as it relates to cardio health. So first, let's just talk about the cardiovascular system and why testosterone is so important.
Yeah, it's great. I mean, again, the pellets in our body, what we use for our body is estrogen, testosterone, progesterone. Those three are used in women. Men is estrogen and testosterone. We don't give pellets to men because of estrogen, because we have it from the testosterone. But the reason why the pellet, first off, is the first time they ever gave hormone replacement therapy was via pellet. It was dehydrated, compressed structure. Later on came that testosterone bound to another molecule called ester. That's the shot. It's still been around since the 40s. Then you have creams, they have gels and patches. And the thing about it is all these routes say they use a bioidentical testosterone. Some molecules like Debald or Nandrolol, they are synthetically different changed androgens, so that they don't say that. But the ones that say they're bioidentical frustrates me because they had adhesives or they're carrier molecules. They're not purely the hormone. The only way to get the pure hormone, the way your testicles making it or your ovaries making it, the only way is pellets. There's no fillers, there's no dyes, there's no colors, there's no nothing. That's really important. Why is that benefits? We're talking about cardiovascular today. Cardiovascular is the battery. The heart is more than a pump. It's a battery. It has electronic charge. It has to go through these miles of arteries and veins back to your artery. You have a lining of the cardiovascular called the endothelial lining. It's just not a tube. It's an active cell that literally keeps away atherosclerosis, that makes platelets stick or not stick. And what's very interesting, testosterone has multiple functions that actually make the endothelial lining healthier. The biggest one is a thing called nitrous oxide. Nitrous oxide is a vasodilator. Testosterone increases that. There's a thing called PAI-1. It has to do with activation of blood clots. Testosterone inhibits that. Also, estrogen causes vasodilatation, which helps, again, with nitrous oxide. These are all benefits to the cardiovascular system. At the heart level, the heart is 35% by weight mitochondria. What is mitochondria? In each cell, we have this nuclear plant called the mitochondria. It turns oxygen we breathe into energy and CO2. Great. So the heart is by weight 35%. Well, what causes that to run? Well, that's built and run by testosterone and thyroid, T3. So that's why it's very, very important to keep the system running properly so the cardiovascular system go. Again, atherosclerosis is when the endothelial lining gets damaged by sugar and seed oils. What happens? Our testosterone, our cortisol, our cholesterol actually helps bandage that. It doesn't cause the atherosclerosis, it actually bandages it. So it all ties together, Jim.
The way you explain that, is that one of the other reasons why in the younger population where testosterone is higher in both male and female, there's very little, if any, heart attack?
Yes, there's a study done at Kaiser in California, and they looked at different men's ages, but the bottom line is men under 500 had a significantly higher chance of mortality, overall mortality, and cardiovascular events. In Dr. Mark Richards' book called Nobody Wants You Healthy, in his book, he quotes a study showing that having optimal testosterone levels decreases cardiovascular events, i.e. strokes and heart attacks, by 250%. It decreases diabetes by 200%. Well, diabetes is a end result of metabolic disorder that leads to atherosclerosis and heart inflammation. So every system in our body is more efficient. At the immune system level, during COVID, a lot of people heard about this thing called cytokine storms. That's when you have your body attacks these things. You want cytokine storm to be controlled. And you have this thing called interleukin-1. That's like blowing the bad stuff out of the bacteria of your body. Then you have interleukin-10, which actually is anti-inflammation. Well, testosterone keeps those in proper balances. Acute inflammation saves our life. Chronic inflammation kills our life. And that's why these balances are balanced by testosterone. Testosterone and estrogen as well. Estrogen is very involved in our immune system. So these are very, very important things that have to be in proper homeostasis.
Patches, creams, shots, orals, pellets, cardiovascular. Walk us through somebody that's on orals and how that may help their cardiovascular health.
Okay.
And what are the differences?
Okay.
And then same thing with
Good.
the rest of them also.
Depends on what molecule. So you can take estradiol orally, but there's a slight increase in blood clots because it goes to the liver, causing an increase in coagulation factors. We knew since 1947 the very first oral testosterone called, it's very, again, it has to do with biochemistry, but the way the testosterone molecule is made, there's a certain carbon that's in what's called a beta formation, which is natural. And there's in 1947, they made a thing called methyl alpha. So they could take it orally. So the liver could not chew it up fast. Well, they found very quickly that increased blood clots, liver cancer. So that's actually been outlawed, but some countries still use it, by the way. Because that's what side note. So orally, you do not take testosterone orally. Nobody's going to say that. They're all going to disagree. Except there's one on the market now. It's called a testosterone undecanoate. They've been used in Europe since the 1990s. It's been approved in America about a year or two ago. And it's taken orally. But the cool thing about it is it does bypass the liver. It's in the gut, but it's absorbed by the lymphatic system, not the portal system, the blood system. Great concept, but only 2% is absorbed. Okay,
so 98% is taken out.
Taken away. Even though it does not, but it does increase diabetes. It does increase blood clots less, but still nowhere near the methyl. So it's a good way to go if you don't shots. So that's oral.
You got to take that every day.
Every day.
And then question for you.
You peak it, but you peak at about 800. You can't peak at the old levels.
Just out of curiosity, how does it bypass the liver? Is it loaded with a bunch of...
No, it's because in your gut, you have liver and you have lymphatic system. So we actually have, make it simple. We have 3 avenues of fluid in your body. You have blood in the arteries and the veins, and you have this thing called third space or lymphatic system. So it runs parallel to those. So it's not going to liver. It goes to the lymphatic system. Okay. The lymphatic system then drains into what's called the vena cava, drafts into the right side of the heart. It's a great thought, but it's still testosterone molecule bound to an ester. Still different molecule. It's not pure testosterone. That's the oral route. The two. So one's banned, one's good. Now it's new. It's just not. It has a 21-day half-life. We'll go to the pellet. Pellet has no half-life. It just goes to the steady state. You have the shot called the ester. So you have testosterone molecule bound to a thing called the ester, which is a carbon molecule, double bound to an oxygen. They have this long lane of carbons with it. That allows it to sit in the muscle for a while as a deposit. You have the propionate was the first one, very short half-life, ethane, and then cypridate. Great. Been used for 60, 70, 80 years. Goes up and down. Half-life of the cypridate is 3.5 days. And that's important. When your T is up and down, the enzyme called aromatase, which converts to estrogen, is up and down. That is never in sync. So the so-called roid rage, by the way, is not testosterone. It's the fluctuation of estrogen. Okay, that's another one to go. But it's not and people say it's bioidentical because when you cleave that ester, it's bioidentical. I got it, but it's still not, all of it's not bioidentical. The next group is called 19-nortestosterone. They take testosterone molecule and they change the molecule at the 19th carbon. So it has a different structure altogether. And the other one is, again, called 17-alkylation, where you can take that one orally because it's a high dose, these long carbons that helps bypass the liver, right? So then they have a cream. The cream has, we did a podcast a little while ago. We talked about the creams, fillers of estrogen creams. The testosterone creams have the same type of fillers. That's the problem. Androgel has these adhesives that we know Androgel has actually increased some blood clots. I don't think it's the components of the testosterone causing it. It's the other ones. The big ones are, there's one out there, a pellet called Testapel, which has testosterone in it, fantastic. Stearic acid, fantastic, both bioidentical. But to make it patentable, they put a thing called polyvinyl propionate in it. It's a disintegrator, which is interesting. The EPA recommends don't put that in contact with skin, but the FDA approved it. There's been cases of blood clots on that. So that's why I want to make it as simple as possible. What can I give will have the least side effects? And this makes common sense to me. The molecule your body makes at the route your body does it, would be the best superior route. Again, we have 90 years of literature on this.
So when you're on these other shorter term solutions
Yep.
that you constantly have to continue to inject or
Well,
give yourself, what's it doing to the heart? Is the heart confused? Is it? Are they? You talked earlier about the benefits of testosterone for the lining and for all the other things.
The interesting thing, Jim, is that the heart benefits still occur. Some of the studies were done on shots as the most common, and still get some benefits. The biggest thing, Jim, is that there's a book out of Belgium that talks about neurodegenerative diseases and sex hormones. And in this book, it showed that the three categories we talked about all have some benefits of androgen and anabolic growth. But all three of them do something very interesting. It's not to the heart, but to the brain. It causes a faster rate of what's called neural apoptosis. It makes brain cells die off faster. So one of the side effects may be increased risk of Alzheimer's and dementia. Cardiovascular-wise, if you're having these cells die off, again, back to the mitochondria again, the question is how much. Let me be very clear here. To me personally, Greg Brannon, I would be on any three of the synthetics if there was not a pellet.
Mm-hmm.
Okay? My second line of choice would be a cream over the pellet. Over the everything but the pellet, because it is bioidentical like the pellet. But the problem is the half-life, it's inside the body in 7 hours.
Right.
And that's the waves. We don't want the waves. There's a great study done in Germany. Well, it has to do with cardiovascular per se. It has to do with how you felt. And they had a study on women, and virtually 100% of the women felt better on pellets. Great study. So this was to men. The same thing to men, but they did it with shots. Only 22% felt better on shots. That's it. Wow, why is that? Then they go, let's try the pellets. They did the pellets, virtually 100% again, because the steady release is key. Because how you feel bad on pellets are nipple tenderness, mood swings. That's all in fluctuations of this hormone called aromatase that makes fluctuations in the estrogens. So back to the heart, Jim. Anything that's homeostatic or homeostasis is the best for the heart, period. Because you want to have a steady release to affect the mitochondria, to affect, it sounds like the concept, testosterone has hundreds of functions at the cellular level. But the biggest thing it does, it makes increased blood flow to the heart. And that's what's very, very important without causing increased blood clots. So when I hear increasing blood clots, that drives me crazy because the mechanism of action is anti-blood clot. It's the synthetics and or the other ingredients added to it.
A lot of cardiovascular patients are on long-term medication.
Mm-hmm.
You're famous for telling everybody how you feel about statins. But the question is less about the effectiveness of statins, but more about are these medications interfering with testosterone in the body?
Yeah, Jim, it's the thing about it is, remember years ago, we had the medication for pain relief, Celebrex. It took, thousands of people dying of a heart attack because it affected this COX-2 enzyme. It's so important that try to give the body exactly what it makes naturally at the optimal levels seem to be the best for healthcare. So when you talk about the heart level, the heart is oxygen. The heart is essential fats, omega-3s and omega-9s. These are crucial things for the heart. Again, cholesterol think about cholesterol. Cholesterol makes up 50% of the heart structure. 50%, it makes up the structure. So it's oxidase cholesterol is the problem. And that means the cholesterol gets an extra electron. And that's caused by sugar and seed oils. Not that itself is bad.
Right. Yeah, it's always confusing too, because a lot of cardiologists will tell you to have a healthy diet, which is fruit, some nuts, low fat, et cetera, et cetera. But the nuts are loaded with seed oils, which I didn't realize until maybe about 2 years ago. So you have to actually go out and find, dry roasted nuts that aren't basically cooked in seed oil.
You want macadamia nuts. There's certain seed oils, there's things we want. That peanut oil, we talked about that before. It's like we've eaten red meat and eggs for 6,000 years. The biggest thing, Jim, is this. 1913, there's a book called The 100-Year Life at the FDA. Less than 1% of Americans had chronic diseases. I was born in 1960. That year's 3% had chronic diseases. Now it's 74%. So that's the issue. The issue is I read this one guy, I think it's Jordan Peterson said, the biggest, let's say, mistake we ever made was the food pyramid. And the answer is true. Just look at the pure science of that. A lot of these diseases, we'll talk about PCO in the pack of metabolic diseases. It's just too much sugar, too much seed oil. It's not too much healthy fat. France has one of the France, Peru, Japan have the highest fat and cholesterol, the least heart attacks in the world. So it's something else.
Yeah.
Let's start open up our eyes and ask these questions.
Yeah. Yeah. So just to clarify, at the end of the day, for cardiovascular health and in general,
Testosterone decreases cardiac events by 250%. In the story, bottom line.
and if the pellet ever went away, you would say creams.
I do creams, bioidentical creams. A certain cream, make sure it's the bioidentical cream, but
Right,
yes,
right.
because there's no fillers again.
Right. Just can't pet your dog or do anything for a while.
I
right?
know, that's why it's secondary.
As always, 15 minutes of wonderful information. Clock talk. Thank you, Dr. Brannon.
Thank you, Jim.